Hi everyone. Today we are going to discuss about persons with mental illness and disability. In this video, I'm going to discuss how a disability is assessed in persons with mental illness, what are the challenges they are going to face in getting this disability certificate, and also what are the challenges the psychiatrist will face in assessment of disability. I'm Dr. Suresh Bada, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Unit, working at NIMANS, Bangalore. First, before we start discussing about the persons with mental illness and mental disability, we will discuss what are the challenges in disability assessment, especially in persons with mental illness. First and the foremost, mental illness are difficult to diagnose. There are no blood test, lab test, urine test, or any neuroimaging, that is CT scan, MRI, which positively says that this is mental illness and this is the diagnosis. There are no lab investigation. That is the first and the foremost biggest challenge. Along with this, there is no any lab test to know the disability quantification. How much is the severe? We don't have any lab test. That is the second important challenge. Persons with mental illness and also the professionals in mental health professionals find it difficult to assess disability. Along with this, mental illness are often fluctuating, episodic, and dynamic in nature. As the stress level increases, the persons with mental illness, the illness also worsens. And if they have taken treatment, it reduces considerably. And hence, mental illness have both temporary certification and permanent disability certification, which has been accommodated in Right to Persons with Disability Act of 2016. That means the psychiatrist can issue temporary certificate, that is temporary disability certificate, or permanent disability certificate. By default, all certificates are temporary, especially in mental disability, unless the psychiatrist mentions this is a permanent disability. In this regard, the 5 years duration is considered as for the temporary disability. But however, the psychiatrist can even mention 1 year, and the reassessment after 1 year can be easily considered. That professional discretion has been given to the psychiatrist under this disability assessment. And also, persons with mental illness often find it difficult to communicate the challenges they face in day-to-day life. Here, the person with mental illness will not be able to say, see, I'm having this problem A, B, C, and how I feel in this society, how my family treats me. Those communication is the biggest problem because the problem is in the brain, which he has to use to communicate with other person. That they find it very difficult. Hence, they become unaddressed in this society. The next challenge is myths about mental illness. That is basically a witch or a magical, or it may be because of the religious reason or because of the devil, witchcraft. That is the reason the person has got mental illness. That means, why should disability be given? The stigma and discrimination associated with the mental illness prevailing within the society would deny their rights. And hence, they will not be given any disability certificate. Along with this, we should remember, persons with mental illness, if the treatment is given early and continuous medication has been given, the disability can be reduced considerably. Hence, many of them say they don't deserve disability certificate. Unfortunately, they put a condition, unless he gets treated, we will not give you disability certificate. On the paradox, there is a limited access for mental health care. The treatment is not available at primary care center. It is not available at community health center and also in the district hospital. Even if it is available in the district hospital, the continuous supply of medication is not there. That means on one hand, you are denying the disability certificate. At the same time, you are not providing the access to mental health care. That means you are doing double discrimination rather than giving the certificate. At the same time, no access for rehabilitation adds one more challenge for the assessment of disability and also providing disability benefits, especially for persons with mental illness. Further, the attitude of the society, which clearly says person with mental illness is acting. Why should we give him? And they do not understand what is mental illness, what are the repercussions of mental illness, what the families of the persons with mental illness go through. Along with this, the person with mental illness cannot defend his rights because he has absent insight. He does not feel that he is ill. He feels that he is normal. And this again added to the society, the challenge worsens. Further, that is the reason various people call mental disability as an invisible disability. It goes unnoticed by the policymaker, unnoticed by the medical fraternity, and it goes unnoticed by even by the family members and the society. This is unfortunate. Hence, the disability assessment, especially with persons with mental illness, need to be proper and has to be done systematically so that no persons with mental illness should go away without the assessment of disability and getting the social welfare benefit, what they deserve under the Right to Persons with Disability Act of 2016. In this regard, we will discuss now Right to Persons with Disability Act, which was passed on 27 December 2016. How we are going to assess persons with mental illness, the assessment of disability is done. There are 4 important disability assessment in psychiatry is done under this legislation. First and the foremost, ideas for mental illness, that is Indian Disability Evaluation and Assessment Scale, that I will discuss today in this video. The next one is mental retardation, what we call it in the older term, but it is also called as intellectual disability. For the functional assessment, we use Vinland Social Maturity Scale, that is VSMS. But however, IQ assessment is done by either by Benekamat or Malins Intelligence Scale for Indian Children. So these two, and the third one is Indian Scale for Assessment of Autism. See, INCLAIN is used for diagnosis. For the severity rating scale, ISI is used. That is Indian Scale for Assessment of Autism. This was notified on 25th April 2016. And the latest amendment was specific learning disability, the Niemann's Battery. The amendment was done on 9th December 2020. What is that amendment? This is the amendment in 9th December 2020. This you have to focus. The Niemann's Battery, which was used for assessment of SLD, was able to tell, yes, this person has SLD, but it did not say what is the severity. Hence, the notification clearly said that whoever turns positive on this Niemann's Battery will be considered as benchmark disability, that is disability more than 40%. Further, there was no mention of psychiatrist in assessment of this SLD. Here, the psychiatrist name was added. So these are the important amendments done for the assessment of SLD. Moving further now, we will discuss about ideas, that is Indian Disability Evaluation Scale for Mental Illness. See, areas of functioning we should know before we move into the disability aspect of mental illness. The mental illness affects the higher function, especially the brain, in that activities of daily living, occupational and biological function, and further you can add social function, cognitive function, interpersonal skills, communication skills, work, motivation, or deficit syndrome. This affects the majority domains of the person. That means he requires comprehensive assessment. If we do comprehensive assessment, unfortunately, we have less psychiatrists to do the assessment. Hence, the assessment of disability should be very crisp, at the same time comprehensive, less time consuming, and can be done, redone, and also it can be inter-rater reliability, retest, test validity should be high. Hence, the government of India came up with this ideas, which was in collaboration with Indian Psychiatric Society and SCARF Chennai. And SCARF Chennai, Dr. Tara did a wonderful job in drafting these ideas. Now let's understand who will assess ideas. IDEAS, that is Indian Disability Evaluation and Assessment Scale, psychiatrist for clinical assessment, and also administering IDEAS scale. That is very essential. And psychiatrist should not directly do the assessment using ideas. He need to undergo training. Once he undergoes training, definitely he can do the assessment. That is about who will do the assessment. Who will be involved in certifying? As per the RPWD Act 2016 and the Guidelines for Assessment of Disability, which was notified on 4th of January 2018, clearly said that the medical authority will be consisted of either a medical surgeon or medical superintendent, CMO, civil surgeon as the chairperson, psychiatrist who will be doing clinical assessment and ideas, and a trained psychologist if required for IQ. See, specifically they have mentioned trained psychologist. They have not mentioned clinical psychologist here. Why, I don't know. This is basically the drafter has done it. So 3 important people are required. One is the chairperson, who can be MS, CMO, civil surgeon, or a psychiatrist for clinical assessment and ideas, and trained psychologist if there is any doubt of mental retardation for the assessment of IQ. How to do the assessment? Where to collect the information? First and the foremost, assessment of the patient, assessment of caregivers, to get all the available case files. That is, if he had taken treatment, what is the treatment response, what medications have been tried, how much he improved, how much he did not improve, what are the side effects of the medicines, and because of this side effect, is there any disability worsening? So all those collating information has to be done. It can be done in one sitting or multiple sitting till the psychiatrist is convinced about the disability. So how much duration to be taken for the assessment? The time taken for the assessment depends upon the availability of information with regard to persons with mental illness and his disability. Imagine if a psychiatrist is treating his own case for many years and that person is requesting for disability certificate. Since it is an old case for him and he has been treating since many years, he can issue the disability certificate very fast because he has all the information required. Hence, the psychiatrist will be able to issue the certificate very fast, maybe 1 week or less than that. But if it is a new case, although patient may be old, maybe suffering from 5 years, 10 years, but he has come to the government hospital for the purpose of certification first time, for the psychiatrist it is the new case, he does not have much information. In that scenario, the psychiatrist will struggle to give disability certificate because he don't have much information about his illness, about his treatment response, duration of treatment, duration of illness, and also the disability associated with this. In such a scenario, the psychiatrist will have a difficult time and he may change the setting. He may do the assessment either in the outpatient multiple times or it may be done in the inpatient to know whether this person is malingering or not. If it is a old case, he will issue in the outpatient basis within 1 or 2 weeks. But if it is a new case for the psychiatrist and he do not have information, he may request for inpatient care because he wants to observe the patient, do serial MSE, and do ideas, IQ testing. And it may require 2 to 4 weeks since it is the new case for the psychiatrist. And here the professional discretion plays a very important role. And hence, I request all persons with mental illness to approach their psychiatrist, treating psychiatrist to get the disability certificate. Or else, if your treating psychiatrist is a private psychiatrist, when you are coming for a government hospital for disability assessment, please bring every details of file, prescription, investigation, and a certificate from the treating psychiatrist, private psychiatrist about the duration of illness, how long he has been treated, what is the treatment response, any side effect. That complete documentation will definitely help the government psychiatrist or the medical authority where the psychiatrist has been assigned to assess the disability. Let's now move into ideas. What are the different domains of ideas? There are 4 important domains. First is self-care. Second one is communication and understanding. Third one is interpersonal activities. It is also called as social relationships. Fourth is work. So these are the 4 important domains: self-care, communication and understanding, interpersonal activities or social relationship, and work. These 4 domains adds on to total disability score. 4 domains is considered as total disability score. Along with this, you may have to add one more, that is duration of illness, DOI. Duration of illness will plus total disability score gives the global disability score. That means 5 domains will be considered as global disability score, which is the final score. The duration of illness is the last 5th domain. Now let's see how to assess each domain. Each domain is assessed from 0, 1, 2, 3, 4. Each domain gets the minimum score of 0 and maximum score of 4. 0 is no disability, 1 is mild disability, 2 is moderate, 3 is severe, 4 is profound disability. For each domain is done, apart from the duration of illness domain. Now let's go into the self-care. Self-care should be regarded as an activity guided by social norms and conventions. That means in a society or in his community, what is self-care means? Self-care in a particular society may be different from a society from a different community. That is basically a person coming from a community from a rural area may take bath once in a week, whereas a person in a urban area setting may take bath twice a day, depending upon his occupation, depending upon his need for cleanliness. So the self-care is dependent on social norms and conventions at that time. So the self-care domains need to be assessed for maintenance of personal hygiene and physical health. What is his eating habits? Maintenance of personal belonging and living space, how he is maintaining it. Does he look after himself? Wash his clothes regularly? Take bath and brush his teeth? Further, does he have regular meals at time or in time? Does he take food of right quality and quantity? What about his table manners? Does he take care of his personal belonging with reasonable standard of cleanliness and orderliness? So these are the various 8 parameters and various questions you can ask. These are all semi-structured. The questions have been given to guide you. You can add any number of questions to assess this self-care. Self-care revolves around his activities of daily living. Along with that, how is his personal hygiene, eating habit, sleeping habit, table manners? How does he look after himself? The dressing manners? Those falls under the self-care. Look at the scoring. 0 is no disability. 1 is mild deterioration. There is no adverse effect on the health consequences because of self-care. Second, the deterioration with mild adverse health consequences like physical health. Problem is there, obesity. There is tooth decay and bad odor. You can feel it. The third, the evidence of serious hazard to physical health, malnutrition, infection. Patient is unacceptable in public. He has a matted hairs. He has in a very unhygienic clothes. He has not changed the clothes for many days or many weeks. And he stinks very badly. That is 3. Fourth, constant supervision is necessary. Somebody has to assist for his self-care. That is 4. So this is how the self-care is assessed. Moving to the next domain, interpersonal activities, also called as social relationships. This includes response to question, request and demands of others, activities of regulating emotions. How does he regulate his emotions? Activities of initiating, maintaining and terminating any interactions if he has with other parties of the society. Activities of engaging in physical intimacies. Who is his behavior? That's what contributes for interpersonal activities. Let's see what are the questions should be asked to the patient and his family members. What is his behavior with others? Is he polite? Does he respond to the questions asked? Is he able to regulate verbal and physical aggression? Is he able to act independently in social interaction? How does he behave with strangers? Is he able to maintain friendships? Does he show physical expression of affection and desire? So all these questions need to be asked to the person with mental illness and also to the family members. It need not be one family member. You can ask 2 or 3 more family members. Scoring. 0 is no disability. 1 means there is some friction on isolated occasion, generally well tolerated by others. Second one is few occasions could isolate himself from others and avoid company, but he still mingles with people and they accept him. Third, severe behavioral problems in social situation and is undesirable generalized problems in the society. Cause a serious problem in daily living or work. Patient is socially ostracized. They don't accept him in the society. As soon as he comes, the people walk away from this place. They are scared about him. And profound patient in a serious and lasting conflict and serious dangers to problems and others. That is dangerous to self and others. That is the interpersonal activities. You are going to score 0 to 4. Coming to the communication and understanding. Understanding spoken messages as well as written and non-verbal messages and ability to deduce messages in order to communicate with others. So basically understanding the other's language, speech, and how well he communicates with others. That is the third domain. What are the questions you should ask? Does he avoid talking to people? When people come home, what does he do? Does he ever visit other people, relatives, friends? Is he able to start, maintain, and end a conversation meaningfully, or else his conversation is completely meaningless? Does he understand body language, emotions of others, such as crying, screaming? Does he do that, or does he understand if somebody is crying, what is happening with them? If somebody is laughing, how does he behave with them? Does he indulge in reading and writing books or hobbies? Do you encourage him to be more sociable? These are the questions you need to ask for communication and understanding. Let's move into the scoring. 0 means no disability. 1. Patient described as uncommunicative or solitary in social situation. There may be social anxiety may be reported. This is 1. Second, in very narrow range of social contact, has few friends, evidence of active avoidance of people on some occasion, and interference with performance of social rules, causes concern to the family. Family are concerned about his behavior, especially with regard to communication and understanding. Third, evidence of more generalized active avoidance of contact with people. Leave the room when the visitor come in and would not answer the door or if there is a phone rings. He avoids actively. Fourth, hardly has any contact and actively avoids people nearly all the time. For example, he may lock himself inside the room. Verbal communication is nil or bare minimum. Then you will score 4. This is about communication and understanding. Moving to the fourth domain, work. This includes employment, housework, educational performance. Score only 1 category in case of overlap. That means if a person is employed, housework is also there, and is studying, you have to score only 1. That means either the employment or the housework or the educational performance. Now let's move into the work. Is he employed or unemployed? If employed, does he work regularly? Does he like to do his job? Whether he is able to cope with the job stress? Can you rely on him financially? If unemployed, does he make any efforts to find a job? In similar way, if it is a housewife, in similar ways, you need to know housewife should be rated on the amount, regularity, efficiency, which tasks in the following areas are completed. Like it may be food, making house, acquiring daily necessities, storing and serving food, cleaning the house, washing clothes, working with those helping and domestic duties such as maids, cooks, looking after possessions and valuables in the house. So these are the areas you are going to look for housewife if they are looking after the home alone. If she is a working woman, you will consider the previous one. If she is a housewife, you will use this. Suppose if he is a student, invariably the mental illness starts in the adolescent majority of the time. In such a scenario, what to do? Assess and score on performance with regard to school and college, regularity, discipline, interest in future studies, behavior in educational institution. And those who had discontinued education on account of mental illness, the disability needs to be scored as 4 because he has become so ill that he could not continue his education, needs 4. Coming to the scoring, 0 is no disability. 1, noticeable decline in the patient's ability to work, to cope with it and meet the demand of work. Sometimes he may explain or threaten to quit. Second one, declining work performance, frequent absenteeism, lack of concerns about all, financial difficulties are foreseen. Third, marked decline in work performance, disruptive at workplace, and poor adherence to work discipline, threat of losing job. He is about to be thrown out of the job. Fourth one, he's largely been absent with work, termination is imminent or he is terminated from the job, unemployed, and making no efforts to find the job will get 4. And if he's a student, if he has dropped out, definitely will get 4. Now let's understand how the global disability score is scored after doing all these 4. That means duration of illness need to be assessed. DOI, duration of illness to be assessed. Duration of illness will be scored from 1 to 4. 1 means if the illness is less than 2 years. 2 means if the illness is between 2 to 5 years. 3 will be scored if the illness is between 6 to 10 years. 4 is more than 10 years. Now, many a time, my friends do ask, how to score episodic illness? You have to take the duration of illness. That means you have to add the number of days he has spent in illness. That is the duration of illness, how you are going to score here. This is a tip that you have to be considered. Coming to the global disability score, that means you will add the total disability score plus duration of illness. Total disability score consists of 4 domains. Plus duration of illness gives the global disability score. 4 items has 4 scoring maximum plus 4 duration of illness completes 20. So the person will get minimum 0, maximum 20 under the ideas. Now let's score a person. If the self-care is, if you look at the self-care, if the person is scoring 3, that means he has matted hairs, he is stinking very badly, he had serious physical health consequences. Interpersonal activities is 2, he has been avoiding people and interaction has been minimal. Communication and understanding is 3. That means he has been almost ostracized by the people. Work is 2. And now coming to the duration of illness, that the total score from the total disability score will be 10, but however duration of illness is 2, that is between 3 to 5 years. And the total global score will be 12. So the global disability score will be 12. Now how to score this 12 for in the percentage wise? If you look at the global disability score, which has been given under the disability assessment guidelines, which was notified on 4th January 2008, clearly says a range. The 12 falls in the range of 71 to 99%. So he will give a severe disability score. That means he will issue a certificate telling that he has severe disability with a range from 71 to 99%. And this is how the range will be given. 0, no disability. If he scores 1 to 6, 40% disability you are going to give, that is less than 40%. If the person scores anything between 7 to 13, you will call it as 40 to 70% disability. If it is scoring 14 to 19, he will be giving a score telling that he has severe disability from 71 to 99%. If he has profound disability, we will call it as 100% if he scores 20. So that is how the global disability score has been given under ideas. To conclude, my dear friends, mental disability score is given in a range, not in a specific number. This is how the guidelines have been drafted, and this you need to educate to the policymakers or the people who are providing social welfare measures. You will say that person has either mild, moderate or severe or profound. On that basis, you will give a range of percentage of disability. Please do remember, mental disability is invisible in nature. Hence, people say that he is malingering. You do educate the persons with mental illness and the society regarding mental disability. And again, assessment of mental disability, it is prudent to be done by a treating psychiatrist rather than a non-treating psychiatrist, because the availability of information, medical records, duration of illness, his treatment exposure, side effects, family resources, and how the rehabilitation is done the treating psychiatrist will be knowing better. However, the law doesn't say that, but invariably it would be prudent if the treating psychiatrist does. And if the treating psychiatrist and the assessing psychiatrist is different, then the treating psychiatrist should provide documents, details to the government psychiatrist who is doing the assessment. And please do remember, when you are certifying, there are two types of disabilities are given: temporary disability certificate and permanent disability certificate. By default, temporary mental disability certificate is for 5 years. However, the disability guidelines also says you can give it from 1 to 5 years, any number of months or years. But for a permanent, you have to mention it is permanent, and they should be eligible for permanent disability certificate. And please do mention that. Thank you very much for giving your valuable time, understanding about mental disability. Please do certify and help our persons with mental illness the disability certificate. Thank you very much. Stay safe.